We're also going to start with a moment, just to take a moment to arrive here together as a group of people from all different spaces and places, but all connected through this time and this session here on Zoom. So maybe just getting a sense of that connection, how we're all connected, and also the natural world around you. I'm just taking a moment to maybe just breathe and feel into that, feel into this community of people interested, working or curious about working in this area of nature and health. Feeling that community of people and feeling the natural world around us that's always there. And of course we are nature, so a sense of our own part in that, our own nature. And then just taking a few breaths as we arrive here together. So welcome everyone to this short talk. And we're going to, as I say, just have a little bit of look at the sort of some of the background to this area. Some people might be very new to nature, health and well-being, others might be very experienced, and we're really aware that there's probably a huge spectrum of knowledge, experience. So some of this, you know, we're trying to obviously support everyone, but there's a chance to just talk briefly to some of the ideas behind nature, health and well-being. It's a huge field, but we can at least touch on some ideas, some little models of practice that we're working with, and then also here in the Bristol, North Somerset, South Gloucestershire area, some evidence, some case studies and ideas of practice that are emerging through the Green Social Prescribing work. But before we do that, I just want to hand over to Marion Steiner, who's going to introduce herself and introduce the West of England Nature Partnership. You have to unmute yourself, Marion.
Hello, everybody. Sorry to make that classic error. I'm Marion Steiner. I'm a family doctor in Bristol, in an area of the city with high levels of deprivation. I cycle to work. I like swimming in cold water, and I grow vegetables. And I'm really interested in how patients can understand their own needs within health and well-being better. And so over the years, this led to a keen interest in social prescribing generally, and then particularly in green social prescribing. And I'm really delighted that one of my social prescribing colleagues, Will, is going to present a project this afternoon to which my patients have access, and actually takes place in a space where I do swim myself. And I'm privileged enough to chair the West of England Nature Partnership's Nature and Health Group. The partnership itself has been going for many years, and the Nature and Health Group's been going for 7 years, and aims to promote nature in everyday life, to encourage nature-based health promotion, and to promote green care, that is, nature being used as a treatment within treatment pathways. I'd just like to add to that, I think the capacity that nature has now for those who develop a nature connection, really understanding the need to rescue us in this climate crisis. And I think this is a great moment that we can recognise nature. So because we've been going for a few years, we were very well placed to become part of a joint project between NHS England and Natural England called the Green Social Prescribing Project. And we bid and won a place on that, I think based on the fact that we have this history of already using nature connectedness in our work in Bristol and surrounding areas. And there was massive enthusiasm for the project. And we've got 2 years, which started last April. And it particularly focuses on developing green care for those with mental health needs. And people who live in difficult to reach communities, those who traditionally haven't been accessing nature, and also in areas of poor health outcomes where health inequalities are very common. so far, 16 different projects have been funded, and there's another wave of funding coming upon us in February. And I have been really bowled over by the range of projects that have been funded. They're imaginative, they're creative, they're very diverse in lots of ways, but most importantly, they're really rooted in the communities that they serve. And I think this is going to be the essence of their success. And certainly that's part of our evaluation of them. So just to give you a little flavour, and some of you will be aware of what's going on or even involved in some of these projects, but there's growing of food, there's wildlife volunteering, there's walking, swimming, cycling, climbing, art in nature, mindfulness, and they are for all age groups, and they are multicultural, truly multicultural. So I'm so proud that we are fulfilling the brief of the Green Social Prescribing Project. They're taking place in a very wide variety of settings, in parks, in city farms, on allotments, in the lake, in the coast, in woodland, and alongside all of these projects, we're developing resources to guide people towards them, and directories which will be helpful in the long term for people wanting to access health initiatives in nature. Of course, the project comes along with a full evaluation scheme, and the University of Exeter are evaluating our project in Bristol. And we are aiming, and I think we will do this, create a legacy that will allow an enduring partnership between nature and health, which is built into the way that our health and social care systems work. So I know there'll be lots of questions that come out of this. I would like to just put the link to the West of England Nature Partnership into the chat so that you can access that. And if you scroll down on the website, you'll come to the Nature and Health Group Green Healthcare publication, which we're just revising because I'm pleased to say we feel we've fulfilled many of the things in that. We need to develop a new vision to take us forward. Just some housekeeping about this meeting. We are recording this. We should probably have said that before any of us said anything, but we're recording it and we hope that's going to be useful. And we're so delighted so many people are here from such a range of backgrounds and geographies, and we'd like to keep in contact with you, and we'd like you to be able to keep in contact with each other, because you'll have lots of shared interests that you might want to develop. So after this meeting, there'll be a survey, which we'd really, really be happy if people could fill in, and that will form the basis of a bit of a network going forward. So enjoy this afternoon. I know you will, and welcome.
Thank you, Marion. Thanks you for that. Yeah, and the project is really starting to really develop roots here, I think, in Bristol area. So the way it's going to work now, so my name's Micheál Connors. I'm from Natural Academy, which is a not-for-profit training organisation in nature and health. And what we're going to do now is have a little brief overview of the sector, just to sort of set the context a little bit. And then there's going to be an opportunity for you to have a few moments in nature or with nature. If you're not out in nature or there isn't nature locally, you're going to have 5 minutes to go out. So just getting prepared for that. If you want to just look out your window, that's fine as well, or just be with images of nature, whatever it is. But there's going to be a little exercise so that we bring this a bit of experience into it, so it's not just us talking. And then we'll have a chance to hear from you. You'll have a chance to go into groups, smaller groups, to have a chat about things, to talk about your ideas, talk about what nature, health and well-being means for you. And then when you come back, there'll be an opportunity to hear from some other speakers about their experience. So that's the basic format. So we're going to start with a presentation, a little bit of presenting some of the ideas. So I'm just going to share that. And hopefully you can see this. So for us, just to give us context for Natural Academy, we do 3-year trainings in eco-psychology, nature-based practice. We also do shorter training for organizations. really bringing nature into work with people or people into work with nature. So we're working with both health and environment sector. And really that integration, I think, is a really powerful space for this work, for nature, health and well-being work. This, obviously, this work with people in nature or going into nature for our health and well-being is ancient, and who knows, how human beings have always had that connection to nature and that connectedness to finding their own health through nature, through our own nature, through nature connection, or through what nature offers us, the plants, the various other ways that nature can support our health and healing. So there's the ancient roots that go way back, and every culture has had obviously a deep connection to nature. But in recent times, perhaps in modern culture, we have perhaps moved further away from that connectedness, and in that maybe lost something that is very important for us in our health and well-being. One of the things that is emerging, obviously, is the human health crisis, and that's one of the reasons why we're here. And in England, the statistics get quite worrying at times. So 1 in 4 adults in England will experience at least one diagnosable mental health condition in any given year. And there are at least 26 million people who have long-term conditions in England, which is quite a huge number. So the reality that we're dealing with in health, never mind what happened with COVID, is vast and complex and challenging for all of us. So really finding solutions that really work is fundamental to the future of our health system. But not only health in crisis, we have nature in crisis. And as Marion said, one of the things that for us as Natural Academy, we're really interested in West of England Nature Partnership is that it really focuses on some sort of integrated approach. And obviously we're dealing with the loss of biodiversity and the impact of that on our own health and well-being. And the UK is one of the most nature depleted countries in the world. And we're also dealing with climate crisis and climate change. And of course, we're already in that situation. That is already here, and we're dealing with it. So one way that we might start to bring these processes together is through nature and health. Is one way that we might mitigate some of those crises. It's not the only way, but it certainly could be quite a powerful way for us to move forward. So with nature and health, we're starting to bring those two crises together and find solutions for people's health and well-being and for the health and well-being of nature. And the evidence is really supporting that now. The evidence for health and well-being outcomes from nature-based interventions is growing exponentially. And there is a huge amount of developing evidence. And today, probably there'll be another, report or piece of research that comes out. And I think COVID-19 has also added to that, because, of course, in lockdowns that have happened across the world and here in Bristol and other areas, nature has become so important, and local nature, not going necessarily to the wilder spaces, but actually the local park or garden or looking out the window or having a walk, has been so important for our health and well-being and really focused us into that. But the evidence is growing, and the evidence is growing fast, as I said. And one of the evidences that we're going to point to is the evidence as set out by the European Centre for Environment and Health at Exeter University, which was used in the 25-year environment plan here in the UK. And it makes bold statements that spending time in a natural environment does improve our mental health and feelings of well-being. There's no doubt of that anymore. And the evidence is, I would say, for me anyway, in my position, and maybe I would say this, is that it's all proven and so important that that is now taken really seriously. It can obviously also reduce stress, fatigue, anxiety, and depression, huge issues in our life, huge issues in our health system. And nature and health programs, process interventions can really start to bring some relief into the system by helping people reduce stress. And I know this from experience working with people in nature for many, many years. The difference it makes, a very simple intervention in nature to people's stress, anxiety, depression. It's quite amazing. But also in more medical systems or more medical understandings, it does boost immune systems, encourages physical activity, and may reduce risk of chronic diseases. And we just heard earlier about the vast amounts of chronic diseases that we're having to live with at the moment. So that's really important for us to understand that, the impact on that. And the other part of nature and natural health is combating loneliness. And could everyone just turn off their sound if someone has noticed that they've got their sound on? The other thing it can do is really bring communities together. And of course, that has to be a real focus for us in order to embed nature-based services for health and well-being, that the community is engaged, the community feels that they have a voice in that, the community feels that they understand why this serves them and serves them individually and collectively. So one of the things it can do, and the evidence shows this, is really combat the sort of crisis we have in loneliness here in the UK and across the country, across the world, and bind communities together. It gives people a real focus. So this is, as I say, evidence that's been pretty well established now. And so even going further into this and more into the holistic level, at a personal society level, evidence is strong and growing that people tend to be happier, healthier, more productive, creative, active, engaged in community civic life when nature is a meaningful part of their lives. And that's a huge statement as well. So that disconnect from nature that perhaps we are experiencing in the West and in other places across the world is really, it's really important to stop that and to help people find that connectedness again. Now, obviously, there's, as Marion said, there's equality issues and access to nature that are really important to be addressed. But the evidence, again, shows that this really makes a huge difference. And this comes from Nature for All. So if you don't know Nature for All, they're a really interesting UN-led organization or funded organization that really looks at nature, health and well-being and nature connectedness. So this slide begins to bring that into profile. You know, we personally, we have our own experience of our own health and our own, you know, the challenges we might face, but we are in a social context, and really taking a holistic view is what nature and health offers. That really full holistic view. Often we hear psychosocial or interventions, but actually when we bring nature into the environment in, that really offers us a holistic picture of what health and well-being is and how we're in an interconnection to the health of the environment around us and to our communities around us, our society and ourselves. And that health is far more than obviously just the absence of disease. It's a holistic process, and how important that is when we bring nature in as well. So we wanted to look a little bit of nature and health in practice, because some of you are here because you may not, you're just beginning to understand practice. And one way to sort of get underneath this is to look at what's known as the Bragg model now increasingly. This sets out that really these services fit into three primary areas. We have nature as part of everyday life. So people just going out for a walk in the park, having time there. That's obviously, we want to grow that process, and some of the Green Social Prescribing work is very much about that. And then nature-based health promotion, where perhaps there's a bit more of a facilitation of a community or individual in engaging in natural spaces, and it might be for, you know, the conservation work or walking through, you know, parks and led by someone or organized. And then green care services, those are more about health and social care interventions, where we are looking at meeting some sort of identified need, health need. So this sort of offers you some ideas about some of the areas that you might fit into these different areas on the sector. So in the green care services, you might have a more structured approach, more fundamental approach as well to making sure that you're hitting holistic health outcomes. So one of the things I said earlier was spending time. So coming into nature is a lot of what we do might be being active or those types of things, but actually stopping and noticing is really important as well. And that leads us to nature connectedness and to being able to take a moment, spend time, And nature connectedness incorporates our emotional response, our beliefs, attitudes towards and within nature. And one thing that we work with quite a lot, which you may or may not have heard of, are the 5 pathways to nature connectedness. This is an evidence-informed set of ways that we might bring people into contact and connection to nature through these different pathways. And if you're interested, there's a really interesting paper by R. Lumber et al., including Miles Richardson, Derby University, Beyond Knowing Nature, and how that gives you the evidence background for where these come from. So in order to sort of have a nature connection experience, we thought it might be useful for you to go outside or look out of your window at this moment, explore a natural object, or look at an image of nature. And the intention is to notice 3 things of beauty and how this makes you feel. So we're going to ask you to just take that 5 minutes now, or a few minutes. So if you could all be back here and back online, if you do walk out for a moment, if you could all come back here for 1:30, that would be great. And then we'll look at going into groups and having a bit of time sharing about nature connection and health and well-being. So welcome back, everyone. Welcome. So hopefully that was a good and useful conversation, good to talk to others and share some of your own experience and ideas and thoughts, and in this developing realm of practice that we're interested in at the moment. And it'd be great to hear from someone. If someone feels like they would like to share some of what you talked about, it would be really nice to hear other people's voices from the participants. So if anyone feels moved, it'd be great to hear just a little bit about what you were talking about.
Don't mind sharing something, so
jump in.
You're not left hanging. I know what it feels like. Hello, I'm Savitha Bhagirathan from Busybodies, and thanks to everyone in my group. I think 2 of the things I'd like to share, we talked about really for ourselves and encouraging people we work with to look out for and use smaller oases of green spaces in urban environments, like say Easton or St Paul's, that kind of demystifying nature. It's not about you have to get out of Bristol for the whole of Saturday and need transport and that kind of thing. It's looking at what's around you as a starting point for some people. And then one of the last points we finished on was about the amount of time. We all talked about, well, sometimes if we can just get out for 10 minutes in our lunchtime, that can be what gets us through the afternoon. So again, those of us who are involved in green social prescribing projects, to put across that, again, it doesn't have to be like you go out of the city for a whole day trip.
Yeah.
It's that regular getting out for 10 minutes and taking in how that makes you feel. And again, for people who might be struggling around mental ill health, anxiety, living with chronic pain, to say to them, 10 minutes could help, and that's fine. We're not asking you anymore as a starting point.
Absolutely. Yeah, that's great. It's really good points, and the reality that most of us are in urban environments now, so that, nature, it's about connecting to local nature, isn't it? It's what's around us, rather than, as you say, that big idea that you have to get way out or go to the wilder places. And also just 10 minutes. But I mean, the evidence shows just even noticing nature makes a difference, even if it's out the window, or like we said, having a bit of time, even looking, at augmented reality or looking at pictures of nature can support people. For people who are housebound or people who are really struggling, to just take even a moment to notice something. And the idea of beauty, the reason we brought that in for this little exercise, is that beauty can be a real gateway to that connectedness, and it makes people feel so much better. It's just uplifting and inspiring. So yeah, and absolutely, you're absolutely right. Just the local, easy access right beside you, and that can be a real part of this whole project, is helping people just feel comfortable and access that. So thanks a lot. That's great points. Thank you. Anyone else have anything that they were like to share?
I think there's it's not just about what we see, it's what we feel, and maybe just bringing back into your interior world an object, something to hold, to touch, that you keep at hand, or perhaps materials to work with, to make artwork, or just to play with. Mud, you know, you can bring it in. You don't have to stay outside with it. And especially for people that, you know, aren't that well or can't get out, you can bring things to them and just play.
Yeah, great. That's great, Victoria. Absolutely. You know, good point. Thank you. And Karen, you wanted to come in as well. You've got your hand up. Is that correct?
Yeah. Sorry. Thanks, Michaela. Just a couple of sort of takeaways from the group that I was in. Somebody mentioned the concept of the phrase, which you may all be familiar with, but it was new to me, but how important it was to take green snacks. And I just loved the concept of that, going out and just, you know, taking a bite-sized chunk of nature or just being outdoors to make yourself feel better. And the other one was describing being out in nature as being multi-sensory. So you can see it, you can smell it, you can touch nature, you know, you can listen to it and hear the sounds. And again, I thought that was really impactful. So.
Yeah, great, Karen. Thank you. Yeah. So yeah, I think that word demystifying that you said, that was really important. You know, that it can be that, you know, people feel they have to go and do something very dramatic, and you're saying that as well, Karen. It's just simple little things all the time is really what makes the difference, so that it's really integrated into your living experience and the reality of your life. And we are busy, and we're, you know, but even for each one of us to take those few moments just now to just notice nature is really significantly beneficial for our health and well-being. So yeah, great to notice that. And also, as part of the Green Social Prescribing, of course, we have got more in-depth services and services that are maybe taking people on a bit of a journey around nature connection or nature for health. So we're going to hand over now to Will, and Will can introduce himself. And Will is going to talk through a project that has been funded through Green Social Prescribing here in Bristol. So over to Will Shipp. So Will.
Yeah, hi everyone. I'm Will, a social prescribing link worker. Trusting, can just one person give me a thumbs up that they can see my screen and hear me? Great, thank you. Just going to talk a bit about what we've done here in Bristol. Marion briefly mentioned earlier Henleys Lake. But first of all, assuming most of you know what a social prescribing link worker is, but if you don't, just a very quick explanation. So as a link worker, I'm embedded in GP practice, taking referrals from GPs and other healthcare professionals, working one-to-one with patients for whom the GP feels that maybe a non-medical approach is needed for that patient. So yeah, we've got one foot in primary care and then one foot in the community. And part of that, having that foot in the community, often is sometimes allows us to run groups, facilitate our own groups. So this is the social prescribing group, and we're very lucky that we have this resource of Henley Swimming Club. Marion came up with the idea of setting up something where people could be referred from their GP through the link worker into this wonderful environment where they could do outdoor swimming. Thankfully, the swimming club were really on board with the idea. They gave us 2 hours weekly access from the start of May through to the end of September, and we've been doing that since 2018. This year we actually launched a second group because well, as you can imagine, it became very popular. It's a social thing and a swimming thing. So, you know, as a link worker, I sell it as, you know, you don't have to swim, because obviously there are those people that just say, yes, please, I want to jump in straight away. And then there are those people that really just want to come for the beautiful environment and the social side of it. And that in itself is a huge pull. Is some people, they just come for a chat, and they're coming week in, week out. Most of my photos are taken on rainy days because it gets to the end of September and I think I better get a photo, and it's often raining. So top left photo, they've all been in the water and it was quite cold that day. So that just shows you how much they've been, you know, people enjoy this, as probably most of you. I imagine some of you already do some outdoor swimming. Paul, just to give you an example, Paul is someone that was referred to me several years ago in recovery, extremely difficult physical condition, and as you can imagine, a sort of very complex medical history. It sort of took him a while to become accustomed to the water, but he showed great courage in just giving it a go. And although he was shivering for about half an hour and for the rest of the day, quite often after he'd been in the water, he kind of got something from it that he kept coming back. And then he came the following year and then sort of socially really integrated into the group. And now he's kind of an integral character, if you like, in the social prescribing group. And it's just been so amazing to see his journey. Someone who, when I first met him in the surgery, you're in the surgery in a very clinical environment, and you just think, what can you do? You're very in a lot of pain, not many social connections, and to see him in that completely different environment in nature, in a beautiful place, and getting in the water, it's just an incredible thing to see that journey. So just to talk about things I've learned, I'm not an expert on all of the types of green social prescribing, but been running this one since 2018, and yeah, I guess we've learned a few things. So where are my notes on that? I think in terms of getting people to come along, some people just want to do swimming, they just like the activity, and you don't need to sell it to them. So I don't know if you're thinking of setting up a group and it's a specific activity, there will always be those people that just want to do that activity. I think as we've seen during lockdown, during COVID, people flock to nature. It's something that is universal, it's something that's relatable, it's something that allows diverse groups of people to meet and connect, because we can all relate to the environment that we're in, to nature, to something beautiful. So that really helps. Yeah, the social element is really important. The way that I facilitated the Henley's Lake group is very informal, very flexible. So we have a drop-in. We keep it facilitated in a very easy, safe, but kind of no structure, just kind of encouraging people to kind of talk to each other. And we found that, well, certainly this year, I found that we reached a critical mass of participants where sort of we were having about 15, 20 people each week, and the group sort of became self-managing, which was so nice to see. And I think that helps. Lack of structure, not too structured, but safe. So some facilitation skills are needed. What else? Some barriers. I think the obvious ones are the weather. We've just set up a follow-on group from this lake group, which is all about a campfire, all about lighting a fire, sitting around the fire, having a hot drink. And we've only just started it, but of course one of the main barriers is simply the weather, and it's cold. So if you're setting up a group, it's got to have a real pull. I think Henley's Lake has such a pull for people because it just is so beautiful. And I think the water element, when you're in a city and people think, wow, I get the chance to go and be by water, I think that really pulls people in. Commitment. So yeah, the drop-in, the kind of taster session model works really well. So people, if it is about going outside, they might not want to come some weeks, or they have other things on. So I like having that kind of drop-in format. Accessibility is obviously a consideration. It's worked out quite well. We've had people in wheelchairs, walking sticks, mobility scooters attend our group. What else? Just going to say something about the types of people that benefited from our swimming group. Generally, apart from Paul, it was people that were signed off work with stress, it was people in pain, people with sort of depression, long-term conditions, and also just people who are lonely and isolated. And I think you've got to use the assets that are around you. I mean, we're just so lucky to have Henley's Lake kind of next door to where our charity is based. I'm just going to go in the chat box to see if any of those chats are questions for me. If anyone does have any quick questions, do pop something in the chat box.
So there was a question, Will, about green social prescribing and the difference between that and
Yes.
social prescribing. I mean, do you see a difference as a link worker?
Yeah, I think we're not at that stage where there's, I mean, where there's loads and loads of green social prescribing options, although coming here today has kind of blown my mind because it sounds like there are loads and loads of things going on, or at least about to kind of erupt. I think it's hard to say categorically whether nature is better or more popular. I think it's just people's preferences. And as a link worker, one of the privileges we get is we really get to know people first before we refer them to something or before we signpost them to something. And I think that's a key part of someone actually accessing something, is have you really tapped into what they're into, what they're interested in. I think, like I said earlier, I think nature is probably a pull for everyone, but it needs to be easy, it needs to be accessible, especially in the first instance.
Mm-hmm.
But I was speaking to my team earlier, and some of them said that some of the structured programs do suit people better. So for some people, they will really like a very structured program in nature, but it's finding that out from the person, what they want to do.
Yeah, well, I think, yeah, because Kelly's going to speak in a moment from a more perspective of that structured program. There's another question around, are link workers available all over, right throughout the Bristol, North Somerset area and South Gloss area?
More or less. We work in North Bristol. We've got link workers all over North Bristol and around 17 practices. And that's reminded me of another sort of point I wanted to touch on, which is that I think what's worked well for us is that this group has been a kind of in-house group. So as a link worker, if I'm referring someone into the group and I ask them to come along, they know I'm going to be there. So I say, I will meet you there at the group, and they've made that connection. Whereas sometimes if I'm referring into an external group where I don't know what the environment's going to be like, I've not been, I don't know who the facilitators are, that patient or participant might find it a bit of a barrier to just go to something cold. So which makes us kind of think in the social prescribing world that if there was training available for actually training link workers, and I think I saw Anita Gardner say something about that, training link workers themselves in some of these nature-based facilitation skills, that would be a real bonus, because then we can do the one-to-one work and then carry that over into our facilitation.
Great. Well, that's great.
Could I just add something, Michal?
Yeah, jump in, Marianne. Yeah.
Yeah, just to say, I mean, we've been so privileged because we have got such excellent relationship with Southmead Development Trust, because we started quite early on doing our social prescribing. But social prescribing is available to every patient across the NHS in England through the primary care networks. But it may be that you haven't yet developed that close relationship with your project or your link workers. Our link workers come into the practice, but if you're a GP on this Zoom and you don't know who your link worker is, I think it would be well worth fostering that relationship and having some reciprocal discussions about what you feel the patients might benefit from, and also letting them know about what's going on, because Kelly's going to talk about training, and that's the very thing that Will just mentioned. The other point Will just made was about using the local facilities, and I think there are probably lots of places across our areas, wherever you are, which could be used as a venue for social prescribing, green social prescribing. And some of them might be golf clubs, and some of them might be private schools with big sports areas, and who, after all, are charities and have a commitment to the community through their charitable status. And I think perhaps if you thought about it, you might be able to, maybe we should all challenge ourselves to find a resource locally that we could start to develop a relationship with, and that patients could access, because this has really opened up the facility for my patients that they weren't sharing, and even though it was in their patch. And I think it would be great for the community and to reduce inequalities if we could do that. Thanks.
Yeah.
Yeah, thanks everyone. Yeah, that's a great point. Just be bold and ask organisations and see if they can give you some access.
Great. Well, thank you, Will. Thank you for your share. But don't mind could you just come off the share for now?
Oh yeah,
that'd be great. Thanks a lot. Yeah. Okay, that's great, and interesting to hear how these social prescribing developments are happening. I know that Marion has been involved a long time. I was also involved for a long time in the very early days of sort of social prescribing, and it's great to see that there's now at least some sort of more significant funding coming through, and it's amazing that green social prescribing has been highlighted through this project. So I think hopefully the learning that comes through this experience will be sort of transmitted further afield, and we can all grow this area of support for people. So just for the last sort of section, just going to come back to a little bit of the ideas that we were talking about at the beginning, and begin to sort of come back to some of the models of practice. And I mean, one of the things that comes up obviously for us as a training organization is, well, what would really support people to both as practitioners or people who are working with other people to really maximize the benefits of the nature connection time that people commit to. So making sure that the most outcomes possible are achieved through the interactions, how important that is. And then also looking at, how do we, ensure that people are competent and confident and capable of, managing and working with groups and working with health issues and complex needs and, all sorts of issues that arrive through trauma and various other things. So we've been exploring this for quite a while now and beginning to understand some of the sort of areas of what feels like areas that need support. And we've been doing this with a number of different organizations, both in health and the environment sector. And going back to this Bragg model is sort of looking at those sort of first two sort of whatever they're egg-shaped things, the nature connectedness as part of everyday healthy living and nature-based health promotion in local green and blue spaces. I think having a good working knowledge of the sort of nature and health field, the evidence base, understanding some of the sort of background contexts that we're working with is really useful when you are delivering, designing, developing service provision for people with either mental or physical health issues, and also an understanding of the spaces locally and the different environments that you can work in and how they impact on individuals and communities and health and well-being is really important as well. So having that knowledge can really help people to feel confident and competent in what they're doing. And also what we've found is that people then feel like they can sustain something, sustain a service, sustain what they're doing, and understand that there's a depth to the work that they're doing. It's, you know, and there's a background support process and a background understanding that they can lean into, a knowledge base, a community of practice. Those types of things are really important for us to develop roots for this work and to help all the people on the ground, and ultimately the participants and nature benefit the most from these investments of time, money, energy that we're putting into this. So we've been looking at these, and one of the areas that feels like it can be supported is really around community engagement and understanding how to, you know, maximize the sort of ways that people can come into a connection to their local green space and start to take ownership of it, start to feel like that green space is safe. And I saw the conversation about safety. You know, there is an issue with safety in green spaces, especially in city environments, where, you know, people can feel unsafe. And so one of the things that may have to happen is, you know, a sort of some ways that can be supported so people can feel safe, and also working in those communities, having skills to understand basic sort of nature, health and well-being interventions of some sort for health, you know, some sort of intervention process that really can support people. And then also looking at sort of maybe if you're wanting to, from that community engagement process, to really start to engage people's health and well-being. So Will, you were talking about more structured programs that might be addressing specific need. So it might be aimed specifically at depression or anxiety or, you know, recovery from addiction or whatever it is, where you're really supporting people, or social needs like exclusion or, you know, or isolation. So there's something about having a skill base that you can understand how to bring people into nature connection and support them in that process and in that journey, and maximize the benefits. I think it's really important to understand that the evidence shows, and I know this from experience, and Kelly will talk to it as well, you know, the transformations can be quite amazing through, you know, fairly simple, safe, easily applied interventions and practices. And so, yeah, I just wanted to highlight that. And we've been looking at sort of roles that are emerging in that community engagement process, beginning to think about that, like a sort of nature connector, a community engagement person, and then more of a nature and health facilitator role. And that's been that's a work in progress. I mean, we and others are exploring this and exploring both setting some sort of standardization around that and some way of, you know, quality assurance and the various other things. And we're part of a community called the Nature and Health Practice Network, which is also exploring those, and I'll talk to that in a bit as well. Yeah, so I think, yeah, I was just thinking about some of the skill bases, and this is something that Kelly will talk to as well, but there is things to consider: evidence and outcomes, practical nature skills like putting a tarp up, someone put in the thing, working with health issues, mental health issues, those types of things. So there is really definitely things that need to be trained, and then facilitation skills, which is a really amazingly complex process to facilitate a group of people. It's never simple, but it can be a really enjoyable experience as well, if you find a way that can do it. And one of the things maybe just to highlight is the difference. This is something we're exploring as well, and it's, you know, it's not science yet, but it's something that maybe helps people. That there is a basic idea of nature-based activity, and that idea of going out and doing anything in nature or bringing nature in, as people were talking about, that's an activity. But where we can start to create a health intervention is when we start to focus on holistic health outcomes, a bit like that holistic map we were talking about. Then it becomes more of an intervention. This is how we are defining nature-based health intervention. And, you know, go back to that holistic model. So it could be that you're wanting to help someone relax, and that's something about their own mental health process and coming out of stress and stress reduction. So that could be your focus. And then we're talking about nature-based practices, and there's something about toolkits, and there's something about understanding that this is a lifelong process, and it takes you on a journey, and it's something that's always there. The great thing about nature and why it is so powerful, you know, compared to other interventions, is that it's always there. It's always right beside you. Even in the most urban environments, there's some sort of green, or there's the sky, there's something, there's the sun, there's nature. So developing that sort of sense of second nature, becoming second, it's just there, and it really supports us on a day by day, sometimes hour by hour basis. And I think that is a real, process for us to sort of learn what are the best practices, what are the best interventions. And that's the next step, I think, for this sector, to really explore that. And we're involved with a few projects that are interested in that. And I'm going to hand over to Kelly now in a moment, and she's going to start speaking about local projects that she's been involved in as well, and specifically with the Avon Wildlife Trust. And so I'm going to hand over to you, Kelly. Are you there? Are you able to take on board?
I'm here.
Yeah, jump in then.
Still trying to figure out whether you'll get to see my full screen or not.
Yeah, it's starting to come.
Is it there?
Yeah, it's the right screen. That looks it.
Yeah.
Pardon?
Looks like it's the right one.
If you click that, it'll probably work from there.
Do you see the full screen now?
Now we can, yeah.
Now you can.
Yeah.
Fantastic. And you still see the full screen. Great.
Yeah.
Okay, so hi, so I'm Kelly, and I'm here to talk about wellbeing with nature and recovery and resilience, which is a new project that I'll be running in Hartcliffe. But first of all, just a little background from me. So I've been at Avon Wildlife Trust for 13 years now. Previous to that, at Wimwell City Farm, and then in London for Lee Rivers Trust. So I provided conservation practical volunteer days, horticulture and gardening sessions, run training, and engaged in empowered communities. But today I'm going to focus more on our self-care courses, which was developed from some lottery funding between 2016 and 2020, and the lessons learned and how that's informing our delivery going forward. So in partnership with Natural Academy, we developed an approach that improves people's well-being and gives back to the environment. So we developed a 6-modular course that over that funded project was delivered as either 18-week courses, 6-week courses, 1-day courses, and everything in between. So we use the 5 pathways to nature connectedness to frame each participant's journey. So I know Michal touched on that briefly. And where it's different from Will's programme, we do use structured nature-based wellbeing interventions that seek clear and health and wellbeing outcomes. So to give you a flavour of our sessions, so we always start with a grounding. So this helps people to be in the present moment and start connecting to that space. We also do a check-in, so that provides like an initial starting point and allows people to have a voice. So with our wellbeing interventions, which I really can't go into great detail because I know I'll run over, but basically this could be, for example, a mindful walk, and then we may reflect on that and how people feel, or it could be a natural crafts activity, bringing in kind of the beauty of nature within the 5 pathways. So we also, what's really important, certainly as Wildlife Trust, is we bring in practical activities. So that could be conservation activities, horticulture, wildlife gardening, but we also do bring in craft activities, cooking on a fire, and even dissecting owl pellets. Actually, we did quite recently. This ensures variety as well, so people can start finding out what they enjoy most, but also it allows that level of physical activity. And also the practical activities, and when we're kind of getting stuck into stuff, it also provides a platform for learning, so people can improve skills and confidence, but also those social interactions around meaningful activities that really do give back to the environment. So throughout the day, we do provide time for reflection, so which is really important. So participants can share their experience, what they achieved and enjoyed, but also allowing them to learn from each other and empower each other. And then we finish a session, we provide them with what we call a take-home activity. So that encourages individuals to really connect with nature independently. So, you know, I know there's a lot of people here, but isn't it great when you see people develop, you know, whether that's a mood shift or a sparkle in the eyes because they spotted a bird of prey, or even laughter over a cuppa. You know, the sessions do offer different things to different people. Okay, so by the end of these courses, so as we're saying, we did 18-week course and 6-week courses. By the end of the course, participants are better equipped with the resources and the tools they need to better care for their well-being, but also for the environment. And it's individual. So for some people, it could be grounding or a mindful sit spot, or it could be going for a walk with a friend or gardening for another. So I'll only just read the top quote here. So repetitive thoughts come in, but I remind myself, when I get those thoughts, I think of what we did here, especially the grounding and concentrating on things. I can actually control it. I can put it aside. So I just, with all the learning, I just wanted to go through a few points, and I'm trying to work out how long I've been talking for.
Only got a couple of minutes.
Just couple of minutes.
Yeah.
Great. So I think, so the biggest barriers is getting people to the sessions. And so, you know, making that first step, that's really important. So we have an application form, and we do call all participants prior to the course, and we invite them for a taster session before they commit to anything. And that's really important. What we were saying is you know, they need some support getting there. And also for referrees, just understanding the level of engagement with each green provider. So for us, we are trained in eco-psychology, facilitation skills, mental health, and, you know, we provide 2 members of staff. So if someone's in crisis, we've got that extra support to help people. And also, yeah, facilities, toilet and shelter can, if it's not available, can be a barrier. So with our self-care courses, we do offer facilities where we can, so that after that, people are more likely to engage. So I'll just move on. If you want to see the Wellbeing with Nature evaluation report, I'll put it in the link in the chat in due course. So just to round up, in Hartcliffe, with all that learning, we are going to deliver a 6-week self-care course with 2 staff, and then offer bi-weekly sessions beyond that, because we know that some people might need a bit more time to engage in the group. With that, we'll offer first aid training and mental health first aid training and nature connection. And we'll work with local partners as well to ensure participants' journeys continued. Now, what I just want to personally say is this is more a structured approach, but in my experience, I've never seen people respond more rapidly and positively to this approach. So I thought I'd just say that. And now I'm swapping hats. So I am now working with the West of England Partnership 1 day a week to help coordinate a year-long training programme. Again, to help referrers access and experience, to get patients to access and experience nature, and for practitioners to find those skills and knowledge to deliver safe nature-based programmes. So next week, the Green Social Prescribing team will be providing an online network meeting on the 26th of January, and I'll put the link in there shortly. Again, please can I highlight this is for people from Bristol, North Somerset and South Gloss. The event will focus on training and also to find out about the local Green Social Prescribing Grants Fund. So the link's there. And I just want to finish off with, I'll put a link in the chat, but we would like some feedback from today's event. And also if you'd like to sign up for future events and information going forward. So thank you. Michal, do I still have time?
Yes, you do, definitely. I mean, so one of the things, do you want to come out of, are you going to come out of your slides?
I can do.
You don't need them anymore, no. So, I mean, one of the things that really Kelly highlighted there was the sort of sometimes quite transformational processes that people can go through in coming into nature and health programs, in a way that working in rooms or in other clinical environments can be a barrier for many people. So, but, you know, ultimately we're here in order to help people recover and be well and be as well as they can, given the conditions they have. So we wanted to finish and we'll at least have the last words pretty much to a participant. So Kelly had agreed that you would read something from a participant or something of a participant's journey.
Yes, no, I am. I was just trying to get the links all at the same time and I've lost them. People.
The link's been uploaded. Stuart has already uploaded. By the way, Stuart has uploaded a link to the monkey.
Yeah.
So the survey monkey.
Yeah, I'll manage that, Kelly, so you can focus on your reading out the participant story. Kelly, can I just check if the Google Doc link you sent to me is the same one, so I can share that as well?
Yes.
Great.
The latest one I sent you. Yeah.
Great, brilliant.
Thanks, Stuart. And by the way, Stuart is the manager West of England Nature Partnership, so you might see him around as well if you come to other events. Okay, Kelly, and thanks, Stuart, for organising this.
Oh, that's okay. So I just wanted to read out a participant's story. Michal did touch on it in terms of the Bragg model, in terms of people go on a journey. So this is a journey from green care to incorporating nature into their everyday life. So the course has pretty much saved my life. Before I started, I was homeless and I didn't have any connections to anyone and I was really low. The course has given me connections to people and to nature that I never had before. It's the first time in my life that any mindfulness practice has worked for me, and I tried for years and years before coming on this course. I was shielding, and I definitely would not have been able to get through lockdown without the resources that the wellbeing team gave me. I'm now able to relax and connect to what's around me. I have all the resources I need to survive, thanks to what I've learnt. I'm finally going to university next month. I wouldn't have been able to without the help of Avon Wildlife Trust. I'm going to focus on sustainable product design. I'm even choosing to move closer to Dundry Slopes so I can be more involved with the volunteering there.
Thank you, Kelly. Yeah, just really honouring that journey for all of us in our own ways, in our struggles at times, and just taking a moment maybe for all of us to think of people we work with or people we know ourselves and our own journey of recovery and wellness and connection to each other and connection to nature and how important it is. And and really, just feeling the connections. So thank you, Kelly. And maybe we'd take a moment to end, to just breathe and maybe just take a moment to feel your feet on the ground. If it's an invitation, you don't have to, but it's up to you. So just to feel your feet on the ground and come into contact with the ground beneath you, the earth, the land, and the natural world beneath our feet, and to come into contact with your breath and taking a few of those sort of transitioning breaths just to sort of come inside for a moment and just digest some of whatever's landed for you from this time together. Maybe there's some inspiration, ideas, thoughts, things you hadn't thought of before or learned. Maybe you learned some things. So just letting that digest it for a moment and And recalling that connection to nature and the moment you took, if you took a moment earlier, and just recalling the beauty of the natural world and how it's always there as a resource to connect to. And for us to also come into that connection, to care about that natural world around us as we become more and more guardians of it. So we'll just end there. And if you want to put anything in the chat, just what you're taking away, or thanks, or whatever it is, or gratitude, or anything you want to, it'd be great. And we look forward to maybe seeing you somewhere in the journey of things. We have a meeting, we have a few meetings, with the one Kelly talked about. We also have a nature and health practice meeting, which I've put in the chat, coming up on the 9th of February. You're all welcome to attend that as well. And that's a local network, and it also reaches further afield.
And Michal, just to note, I'll send over an email to all attendees with some links to everything we mentioned, the survey, sign up to more information, and the event you mentioned, and a recording and the slides.
Okay, brilliant. Thanks a lot. Thank you, everyone. Go well.